To kind of kick the conversation off, my name is Shada, and we are starting these conversations on my personal Instagram channel because I am about to give birth, like literally, I feel like any day slash week now. I think this week is 38 to 39 weeks. And I've been so inspired by the birth community here locally in Austin and just through content sharing, me personally oversharing my pregnancy journey, to really find community and realize that I can help be a hub for that community. And so I'm in the process of launching another brand called Mother Acres. That's going to be like a community, product, resources kind of repository. And so I'm trying to like tie it all together. And one of the ways that I want to introduce content are through these kind of community lives, community videos, community chats with experts that are really speaking on topics that I personally have been curious about, have used myself. Again, kind of spoiler alert for the listeners, you're my chiropractor. So I was very excited to get to have the opportunity to sit down with you because, again, I think there's so much that happens when you are, especially for first time moms, like transitioning into or like first time pregnancy. I mean, even the trying to conceive phase, I definitely get a lot of messages about that as well of just, hey, I'm thinking about entering this new chapter in my life and what do I need to know? And so for me, getting pregnant and having a history of some chronic pain thanks to a car accident I was in 2015. For the listeners who may or may not know, I was hit by a vehicle as a pedestrian, downtown Austin, fractured my sacrum. And so for me, I've been very, one, hyper aware of any inflammation and pain in my body just since kind of that experience in my life. And two, I've also been on this like massive health and wellness journey of just trying different modalities. And to me, it's not that there's one explicit thing that you do. It's that there are maybe tools in a toolkit. And so how do you understand those tools in your toolkit to implement at the time that you need to grab for something? And so for me, I have had a long positive history with chiropractic work, but getting pregnant again was kind of this transition for me of, oh, I didn't even know that you could get adjusted for prenatal, for pregnancy. And obviously, we'll get into all the benefits of why you might want to consider doing that. But I'm super excited to be joined, like I said, by my chiropractor, Dr. Allie Goodwin of Lotus, ATX. And you also do acupuncture as well. So please give us an intro, who you are, how long you've been practicing, your myriad of hard-earned, hard-worked credentials, and we'll start there.
Um, Thank you, Shada. That was such a great, I mean, it's always great when, it's somebody that and you have a good experiences in their office. So I appreciate you having me on. So I have been in practice 18 years, a little over 18 years, which is kind of wild to say because it's either, you feel like some days it's like you just got out of school and other days you feel every single one of those 18 years, which is great. As you mentioned, I have a doctorate in chiropractic. I also have what's called a diplomate in acupuncture and a certification, in chiropractic acupuncture. Through the state of Texas. And then also too, I'm Webster certified. I'm a member of the ICPA. I also am a birth fit leader, kind of all of these just certifications. I'm a huge nerd basically, and just continue to kind of learn and grow in order to best help my patients, right? Both big and small. Lots of, I guess, hands-on experience. And then also too, just, my own life, my own pregnancy, my own birth journey, all of those things kind of combine in order to treat my patients.
Yeah, I know. I have been so grateful to you. Your reputation precedes you just to boost you up a little bit. You are highly recommended in the community here in Austin. I have a couple of girlfriends who, when I first again became pregnant and started diving into like, okay, well, what is prenatal chiropractic and what is Webster certified and what, what does that mean and why would I need this? Who were like, you have to go see Dr. Allie with Lotus. And then once I started seeing you and kind of started, sharing a little bit more about my journey just through some of these different modalities that I was leveraging, I had people who were like, oh my gosh, I've seen Dr. Allie during my pregnancy too, or postpartum or with my baby. And so it's really encouraging just to have the reinforcement of like, you are a well-respected practitioner, you know your stuff. Every time I walk into your office, I leave smarter, more informed, and like, yes, like the adjustments are wonderful. And obviously we're going to talk about the benefits of getting adjusted. But I do think the bigger, community and like knowledge share is so important, especially for first time moms, because it just is such an unknown. It's like, I don't know what's happening to my body. I do not understand what this symptom is. And so that extra bonus, like information, like you said, just over the accumulation of however many moms and babies and just family members in general that you've helped adjust and assist over the years is just tremendous, adding that value of wealth to what work you do and why I think it's been so effective for me. So to kind of dive into some of the questions, right? I think I have been seeing you probably since week 12, 13, 14. Again, for me, that was really, I think, ushered in because of my history with my pelvis injury of just, I hear that I need to get prenatal chiropractic work done. I have had a pelvis injury, and my understanding, which the question to you is, what exactly is happening when you are seeing a pregnant patient? Like, what is the benefit? Why is she coming in to get prenatally adjusted? Because again, for me, because I had had some trauma in my pelvis, and there was some fear for me of like, oh no, like is that going to be an issue when I'm actually going into labor? And the other side of it is just my body's changing and my load bearing and my weight. And I already have sciatic pain. And so, oh my goodness, what's going to happen to my body? So let me just go ahead and kind of, circumvent some of it. I think I've mentioned in just other conversations, I'm a big believer of like preventative versus, kind of dealing with things after the fact. And so for me, again, I came in maybe earlier than you traditionally see patients, but kind of like what is the window for when women are coming in to see you? And then what are some of the um, benefits of chiropractic adjustments during pregnancy? And then like what specifically is Webster chiropractic? Yeah, certification.
Okay, I'll see if I can remember all of those. So chiropractic at its basic is really about the nervous system, right? Your brain's the master control organ in the body, sits in the skull. As it exits the skull, it tapers into the brainstem and then into the spinal cord, right? Spinal cord runs down your spinal column, your spine sits around that. And then exits on either side are spinal nerves, right? That take signals from your brain out to every organ, tissue, muscle, cell in your body, and from those things back to your brain. So chiropractors, at any age, and babies to the oldest person in my practice, is really about making sure that the nervous system is functioning at 100%, making sure that the bones that surround those nerves are not compressing those nerves, right? And again, there's kind of this common misconception about, well, I'm not in any pain, I shouldn't go. Well, that's actually not true. You can have what's called spinal nerve dysfunction or nervous system dysfunction without actually having pain, right? Pain is only like a third of the nerve bundle itself. Um, so again, I always tell moms too, like we really want those signals, especially in pregnancy, especially in those first few weeks of pregnancy. And again, kind of at the end, although the middle is also important as well, that those signals going between your brain and your baby, right? Baby, cervix, uterus, vagina, that whole area functioning the way that they should be, because your body, your nervous system is the one that actually is turning around and creating a human from scratch, right? Your body is telling the baby's body how to grow, and it's called that innate intelligence, right? Everybody has it. So again, we really want those signals again during the whole pregnancy, really getting to where they need to go so that baby gets everything. And baby is also a little hijacker on mom's nervous system. So whatever we can do to strengthen mom's nervous system, to calm mom's nervous system down kind of throughout the pregnancy is a really, really great thing. So prenatal chiropractic then on top of that is really more about balancing out the pelvis as much as we possibly can, right? Making the pelvis as bowl-like as possible instead of kind of wonky, or again, the sacrum, which is that triangle piece of bone in between the two hip bones, being stuck or rotated, kind of any of that, taking that off the table, right? And really creating all of the room baby needs. And then also to allowing those joints to also move as relaxing kind of hits and the pelvis shifts, and baby gets bigger and the uterus starts to kind of pull out of the pelvis. So, prenatal chiropractic and then Webster specifically is about balancing out the pelvis as much as we can, and then taking pressure off of those ligamentous structures that hold the uterus in the pelvis, mainly the round ligaments in the front and then the two sacrotuberous ligaments in the back. Webster's, as I just mentioned, is that Webster's is actually a way to evaluate the pelvis. You can actually use Webster's on men. Although you're not obviously taking pressure off of uterine ligaments for them. It's really more about kind of what the pelvis is doing, what the sacrum is doing. I personally check tailbone on pretty much everybody who comes in my office because, again, we've all fallen really hard as a child, and that also plays into pelvic floor tightness on one side or the other. But yeah, that's Webster's really is more about, yeah, just really balancing out the pelvis and then taking pressure off of those ligaments, so that there isn't pain, but then also too, the pelvis is able to shift and grow as the uterus is also growing and baby's also growing.
Yeah, it obviously makes sense functionally just because there is so much change that's happening in that area. And then I think a word that maybe is, I don't know if it's appropriate, inappropriate, but just like the trauma of your body, what your body's going through, right? That's again, I think I don't mean it in like a negative way. I just mean it in like a realistic way. Like your body is literally pushing a baby, which is normal. It's totally normal for the baby to go through. But like you said, maybe there have been previous injuries. Maybe there's just it's the first time your body is, going through pregnancy and adjusting. Like I know for me, I had really crazy rib pain really early on and just like feeling everything kind of move and shift. And it's so interesting though to me too, because it really has every day is a different symptom or like a different intensity of the symptom. And so trying to just like find any understanding of that or relief in that, or just like, how do I navigate and like move through this? Again, to me, chiropractic has been a tool in the toolkit for me of like, okay, I'm going to go get adjusted. And so I think when I first started seeing you, we were going every week just to get kind of in sync. And then kind of when you're going through the middle of pregnancy, it turns into kind of bi-weekly. And then once you get towards the end, which the punchline for both of us that we know is obviously you're delivering the baby, and part of delivery is you want that baby to be in the optimal position. And
Mhm.
so one of the big, I think, concerns in the world of birth is a breech baby or a baby not being in the right position. And again, I think as normal and natural as birth is, sometimes there are things that prohibit the baby from getting in that heads down, back kind of up against your belly position for optimal labor and delivery. And so I think that too, as you're getting closer, it's like the baby's moving around and the baby's flipping and it's so exciting. And then these last couple of weeks, I'm like, okay, Allie, we got to make sure he's down. I think he's down. Okay, now he's down. Can he, like, is he going to stay down? Is he going to move? And so I guess like maybe touch on that a little bit too of like, I think again, it's not that it's an explicit like your body is going to do what your body wants to do, your baby's going to do what your baby wants to do, just like the whole, can you predict the actual birth date of the baby? As I'm like in these final days and weeks, I'm like, I don't know, he'll come when he wants to come. So obviously there's a myriad of ways that babies end up positioned, but just given your expertise and experience, like you're trying to help guide the baby down that pelvic bone and get them to be comfortable so that they can come out heads down, and maybe go into a little bit of like, why is that an optimal position? And maybe people don't really understand, like what's the worst case if the baby is even sunny side up, maybe, right?
Well, I mean, worst case in the pelvis not being kind of as bowl-like as possible, or like if you're looking up a straight shot through, right? Is that you end up having like an incredibly long labor, or it can be very painful in a sunny side up baby. So a sunny side up baby is a posterior baby, which means that its back is against your back, right? We really want baby
Mm.
back to be, as you mentioned, towards the belly, because then that means that the smallest part of the baby's head, which is the crown, right? Baby, when baby gets in the pelvis and is chin to chest, the crown is what comes through first, right? It comes over the tailbone a little bit easier, comes down through the pelvis a little bit easier and out. So a posterior baby is a baby that has flipped up, where its nose is going to come out. Basically, your baby's going to come out like looking you in the eye, basically like looking straight up. And that's a lot harder because then baby is like this, and baby has to come over the tailbone to then come out as well too. And that's an incredibly long, usually pretty painful birth, right? Just because baby's not in the optimal position. So yes, and you mentioned breech as well too. So breech first babies typically turn between 32 and 37 weeks. There's a pretty big growth spurt between, and a first pregnancy between 30 and 32 weeks, and babies usually flip after that. Babies can also go head down before that, but we're really not really looking at that until about like 32 weeks, 30. I think most places do ultrasounds, I think at 32. Or even at 30. And so again, breech usually just means that baby is like either butt down or feet down. They're not with their head down, right? They haven't flipped to go head down in order to come out of the birth canal. So chiropractic, again, because its very nature is about balancing out that pelvis as much as possible, right? Again, it's giving baby enough room to go where it needs to go. And in the case of like a posterior baby, or there's also a presentation called asynclitic, which is a really fancy word for ear to shoulder. So sometimes babies can be slightly, or they can be chin to chest, but slightly cocked like that, either side. Those also can kind of present themselves in late pregnancy in specific things that I'm checking on the table, right? Certain things, red flags usually for those are like all of a sudden a mom is having like a single sided SI joint issue, like pain, sometimes feeling baby like in the hip, but not necessarily over the pubic bone. Um, I'm trying to think, lots of sacral rotation. I usually see that too. So there are ways for me to kind of address that in the office as well. And then some very practical things to do at home, especially in a posterior baby, right? Really avoiding being reclined, especially in those last few weeks of pregnancy, really kind of keeps baby in an optimal position. But again, when we're giving baby the room that it needs in the pelvis, right? Again, keeping those bones, which then in keeping is going to keep those muscles in turn is going to keep those muscles relaxed. Again, we have a better shot of that not even being an issue, right? A lot of these things not even being an issue toward the end. Most of the breech I see is usually people who have gone in and they're like 34 weeks pregnant and then we're kind of on a clock. It's a little bit, it's not impossible, I guess, to get a baby, right? And I'm not doing the flipping. What I am doing is I am putting the pelvis back where it needs to go and
Right.
sure those nerves are going. And babies are always, I told somebody this the other day, I had a brand new breech mom on Monday, and I was telling her, you're going to get really tired of me telling you babies are incredibly smart. They are incredibly smart. They will not go where there's not room or where they are not comfortable, right? So again, if baby is like flip, and again, a lot of times babies are flipping down and then they're like, nope, that doesn't feel good, or I'm not comfortable. And then they'll kind of flip back up and kind of stay breech. That's usually what's keeping their breech. Now, also too, there, as you said, babies kind of sometimes babies won't flip, and that is because they know sometimes something that we don't, right? That's also what I tell my patient. If we're ever in a situation where baby is not turning, then baby knows something that we don't about where they are, if the cord is somehow tangled, right? A lot of those things you can't even see in ultrasound. So again, it's always worth a try if you have a breech baby or even like a posterior baby, even just one adjustment at the very end. I have seen women at like 39, 40 who come and see me and then have their babies pretty quickly after, not necessarily because of the adjustment, but just like we're just ensuring that baby is in the best position it can possibly be. So it's kind of fun at the end to make sure all that.
Yes, I'm sure more fun on your side as the woman about to push the baby out. I'm like,
Yeah.
yes, so fun on these final stages. But no, I'm grateful because my baby, for all intents and purpose that I know, I have personally declined any, final ultrasounds. Just the woo woo in me, and so we're kind of going off of feeling the belly, and I feel his butt a lot, and so again, I want to believe that yes, the baby is intuitive, the baby knows where to go, but also it's been a combination of working with you, doing these adjustments regularly. But I guess like the other addendum to that I'll add too is like, to your point, some women are not coming in and seeing you until like super late, but you mentioned so many other things, right? It's like, well, how are you sitting? Like for me, I've had to adjust my office chair to be sitting. I'm sitting on a birth ball right now. Like I'm really mindful of, I don't want to be in a reclined position. I usually, like if I'm on the couch, I'm laying on my side. So I think there's other things, of course, again, kind of in that analogy of like a toolkit, to be educated, just to be aware of like, hey, this is like how you can help your body outside of going and getting adjusted to give your body and your baby the best chance of going into the right position. But you mentioned a couple things. One, obviously, if the baby is in in any position, even a healthy, heads down position, you also do, not prenatal, but postnatal, you adjust the baby as well when the baby comes out. So I want to get to that. But before we get to baby, and I can only imagine again, just what the baby is going through when it's being, pushed through the birth canal. And depending on the position that the baby's in, they're so sensitive. And I've been learning about their little skulls, and their skulls are compressing, which again is like, why you want a heads down baby? Because that is going to put the pressure on your cervix to open and like, pop that baby out, which is wild. But you also were touching on a little bit of some of the reasons that maybe mama might come in and see you. And so I just want to kind of expand on that a little bit, because maybe someone's listening and they're like, I don't need to go see a chiropractor. And it's like, oh, hey girl, you're having rib pain or low back pain, or like it's again, it's not even just the idea of, hey, my pelvis, again, for me, the trigger is I have a pelvis injury and I have to push a baby through my pelvis. So like the pelvis is already like so self-aware for me, but maybe I didn't have a pelvis injury. And then I'm like, surely my pelvis can make room for the baby, which again, normally, traditionally, yes, but we sit in uncomfortable positions. We are, these hunched over human beings now working on our devices. And so I can only imagine you get out of alignment, you're sitting, maybe too long in a car, on a plane, on the road, whatever the case may be. So kind of give us some examples of like what women should be looking out for, maybe as like symptoms that are like, oh, I didn't know that chiropractic adjustments prenatally could help me just get my body again, like back in alignment so that I can then start working on the best position for baby to come out of that birth canal.
So really my kind of, I was about to say, I don't really have a favorite patient. That was going to be kind of facetious anyway, is really one who kind of comes in like you did, right? Which is like, I'm not really in pain. Right. But I know I've heard this benefits me and I know my body is shifting and changing. Right. So I try to encourage people to come in before they're even kind of in pain, because that is much, much easier to maintain, right? Fix it without kind of, again, having to go into that sort of, oh my gosh, now you're in really a lot of pain, right? We're really good at that. Chiropractors are really good at pain relief, right? Even though for me, it's more like we're fixing the nervous system as well. So I really like seeing people pretty much as early as they feel like they can come in, right? Especially because, again, it gives us time to kind of get ahead of the changes that really happen in between 20 weeks and like 32 that I mentioned in a first pregnancy. You hit a pretty big growth spurt about every 2 weeks. So there's a huge growth spurt between 20 and 22 weeks that's kind of when most people's bellies pop for the first time. And then there's one at 24, there's a bump of one at 26. Sometimes there can be a tiny smidge of one at 28. And then that last big growth spurt where baby really packs on all of the fat it needs to survive outside of the womb happens in a first pregnancy between 30 and 32, right? Sometimes that happens a little bit earlier in a second and subsequent pregnancy. So especially in that area, that is a really common, like usually I will start seeing people around like 20 or 22 weeks. And I'm like, let me tell you why this started 2 weeks ago, or let me tell you why you haven't had issues and then all of a sudden you are. It's usually because the body is being asked to stretch and grow. And I always make kind of I guess, a silly joke, but it's so true, is that your body is sometimes being asked to change every second of every day in a pregnancy, right? Because baby is, there's so much coming online for them. And then obviously, relaxing and your body is shifting, kind of all of those things. So I can see women literally at any time during their pregnancy. I will say, if you're waiting to have pain, or you're waiting until you're in pain, it will take usually a little bit longer to kind of get you out of pain. Pregnancy is real hit or miss with that, because again, I don't know how anybody is going to respond. And because of relaxin, right, that lovely hormone that we want in our bodies, right, because that is really what allows your pelvis to completely separate as baby comes down and through, right, which is designed to do. You won't feel any of that. But relaxin at certain points during pregnancy just makes things shift. And there is this weird sort of oxymoron that happens. It's like this weird thing where your joints feel very, very, very loose, but your muscles feel very, very, very tight, right? And it's because relaxin is working on your joints, and then your muscles are like, "Oh, we got to stabilize," right? So then there's this tightness kind of around that. So common things I think that people come in with, rib pain, as you mentioned, is a really, really common one that not very many people seem to be talking about. Um, I would say probably like 85% of the pregnant moms that I see at some point in their pregnancy will have rib pain, or under kind of right breast pain. That is really, really common because, as you mentioned, as baby's growing, it's shoving all of your organs up. Most of your organs sit on this right side, and that's going to shift the rib cage as well, both in the front and the back. Pain in the side, pain in between the shoulder blades. Obviously, you mentioned any sort of like, and I hesitate to use the word pain. A lot of times it's uncomfortableness during pregnancy, like low back tightness, around ligament, maybe triggering here or there. Nothing really constant. It's just kind of all of these things that kind of add up to be like, oh yeah, there's a pelvic misalignment in my brain, right? That's the way I look at it. But like low back pain or uncomfortableness, sciatic is really common. Hand pain has been a really big one, both pre and postnatally. For women, not just carpal tunnel, but something called de Quervain's, which is really more like here. And again, postnatally, right? I call it the mom claw, right? Because we're constantly holding baby. And then there's also too like nursing or feeding mom's neck and back, right? Because you're looking down at this beautiful thing you made, constantly feeding, constantly kind of slouching as well too, as the relaxant is kind of leaving your body postnatally. So I also have like knee pain, foot pain. But yeah, a lot of times it's kind of low back, sacral pain, pubic bone pain, just kind of generally in that area. But yes, things like, neck pain can get worse, sometimes middle of the back pain, rib pain, just generally uncomfortable. And it's because your body is doing the best that it can to compensate for these changes. And then all of a sudden it will get to where it can't compensate anymore. And that's usually a great time to come and see me, or even maybe before we get to that point.
Yeah, no, I appreciate you sharing all that. Cause again, it's not that like, I mean, maybe this is like unkosher to say, but it's not like going and getting adjusted and I'm like, oh my gosh, I'm better like infinitely. It's like
You're
you're great. You're great. You do a great job. Again, my mind is like, I'm doing this for my pelvis primarily and
yeah.
everything else. I mean, we both touched on it, right? And you know this from being a mom as well. Like every day I feel like I have a different intensity of my symptom. And
Mhm.
so it's again, it's not that like the adjustments are explicitly like taking that pain or that discomfort away, because that discomfort I feel like is something like I'm constantly kind of chasing, just depending on how my day or my night went. And I think I was mentioning with you too, like didn't sleep so great last night, but like the night before slept wonderfully. So it's just, what position have I gotten myself in bed? What other kind of, inputs are happening in my life? But again, to me, the value is in just being aware of these things and knowing that there are practitioners, there are tools, there are things that you can implement into a routine, right? And so I think you've been touching on that throughout this whole conversation. It's not, again, which it's fine. Like, hey, come see me, you're almost at your due date, but like, hey, if we can catch this stuff kind of beforehand, how can this be a better aid and support to you navigating through it? And again, I think that's where just our relationship and our conversations have been so helpful, because again, it's not like, oh my gosh, hey, Dr. Allie, I'm having rib pain. You adjust me. And I'm like, oh, the rib pain went away, for the next week or two until I see you next. But you inform me of like, hey, this is normal. This is kind of like what's happening with your body. Like this can give you some alleviation. I remember one time I came in, you like helped tape me. And so it's just, again, it's more the support of, hey, this person is really knowledgeable about what is going on in my body. And that I think is a really beautiful thing to have, because, especially when you're going through this for the first time, it's just like, I don't know what I don't know. And so being able to get the adjustments, but also just the expertise that you've accumulated over the years, I think is really helpful. And
Thank
so,
you.
oh my gosh, absolutely. So thank you. I literally feel like so much smarter when I leave your office.
Well, I often tell my patients, I'm like, you're going to get so tired of me telling you, like, this is literally just where you are in your pregnancy, right? But also, too, this is why, right? Like, I'm going to just kind of word vomit on you when you come in. Like, you're having this symptom that totally makes sense. Let me explain to you what's going on. But yeah,
But
yeah.
the assurance, sometimes you need the assurance from someone who's like been through it, who understands, especially like, our bodies and like how these changes are happening, both from that like emotional, but like also the scientific perspective. It's really special. And so I just appreciate like all the information sharing and being able to like have this conversation. So I'm hoping whoever's listening is like, okay, maybe like I should consider that, or like ramp it up and maybe just like dive in a little bit deeper to understand what's going on with their own bodies themselves as they're navigating their pregnancy or conception journey. Going into, I don't want to keep you too much longer, but going into some of the, I guess, like post partum chiro care, you mentioned obviously like some of the things that as mom, like we're hunching over, we're breastfeeding potentially, we're holding things. I've been seeing, as an aside, so many Instagram reels right now of like moms like, holding like a weight in their training, like with a single weight. And it's like, what are you training for? And it's like to carry my kids' toys, like, across the playground. And it just made me chuckle, because it's like, there's like health and wellness, but then there's also like when you mom, like sorry,
Yeah.
you're squatting, you're getting on the ground, you're carrying now a baby. Like I had to hold my friend, not had to, I love to hold my friend's baby. Thank it. Any friends who have babies, please let me continue to hold them as I, prepare for my own. But they're heavy, they get really heavy really fast. And that just was a little abrupt of like, whoa. I already, again, for me, I have a little bit of a displacement of like my strength because of my pelvis injury. And so it's just like thinking like, okay, like how are you going to carry this baby now on this one side? And you have to kind of adjust and things like that. So anyways, the question obviously is leading to, seeing mamas postpartum, because obviously there's like a lot of things that are happening to their body, especially after they give birth. But then also you're seeing the babies themselves, and we've touched on it a little bit, but just want to, expand a little bit more on like, what are you really looking for, and kind of like, what does that look like? I mean, obviously a baby body is much different than a human full-size body. So, I'm a lover of like, when I hear the cracks, like, our baby's getting cracked, like what's going on with them? Just some of those benefits of, postpartum for mom, and of course, after birth for baby.
Yes. So again, as we mentioned, your body, as you are birthing your baby, right, your entire pelvis kind of separates, right? That's what that cartilage is in between the pubic bones, right? That's what the hips kind of spread out, and the sacrum actually acts as a trapdoor and kind of moves out of the way, up and out of the way as baby comes down. Again, you won't feel any of that. But again, you are pushing a human being kind of out of that area. And even for moms who have section births, right? Surgical births, that is still a lot of trauma on your body, right? Different trauma, right? You're still getting a baby out of you, no matter how you birth your baby. But so for both, again, postpartum, what we end up seeing, as I said, a lot of like nursing moms neck and back, kind of feeding your baby, right? Looking down at them. Also, too, you grow about 37% more breast tissue with every pregnancy. So again, those of us who are kind of more well endowed, right, then our breasts get even bigger. And then during breastfeeding, right, your breasts will expand and contract as they're filling and emptying with the milk, right? That also puts a lot of pressure, even if you're braless, right? Even if you're going braless at home, kind of nursing all day, right? There's still just a lot of pressure on that rib cage. There's a huge hormone shift about 3 to 4 days postpartum, and then there's another hormone shift about 7 to 10 days postpartum. My kind of general rule of thumb is unless there are, which we'll talk about it a little bit more in a little bit, latching issues, like baby really, really uncomfortable, torticollis, like some of those things with baby. I usually just tell my moms, like, take that first week, settle in, get nursing going, feeding going. And then really, if I can see babies before 2 weeks, but both mom and baby before 2 weeks, at the end of that 2 week period, that's a really great thing, because of that second hormonal shift, things will start to tighten up in mom again, right? So again, usually they were talking about like relaxin being in your body for about 6 to 8 weeks. It's really more like small amounts of relaxin, really 6 to 8 months. You are considered newly postpartum up to a year. It takes your body hormonally 2 years to get back to normal after a pregnancy. And then really new research that I think released last year or the year before is now talking about it really takes your body, 6, 7, sometimes 8 years to really get back to quote unquote normal before baby. So again, and I know people have babies back to back, and there are things that you can do to remineralize, like all of those things as well. But just going through that, right? Being newly postpartum up to a year, your body still shifts and grows, still has relaxin in it. Breastfeeding magnifies the amount of relaxin left in your body. So things are still shifting. And then, as you mentioned, they get heavier and heavier. They're also no longer in your belly. So the weight difference, or the center of gravity, right, is different. Now baby's being held up here, right, which puts a lot of pressure on that mid back as well. And then you're also sitting, which is also going to mash the sacrum, mash the tailbone, kind of all of those things as well too. And as baby comes out, it can be common postpartum to also see tailbone pain as well a little bit. And again, there's lots of things that we can do. I'm a huge fan of pelvic floor PT, right? There are really great programs like Birth Fit, right, that help kind of heal diastasis and pelvic floor, what we call the core canister after birth. So again, we're talking all about that as well too, like how to best support your healing postpartum, sometimes even before you have the baby, but really afterwards, right? So those are really the wrist pain that I was talking about, the mom claw thing. That's really, really common too, because again, you're holding this baby as they get bigger. Most of us always do the mom hip thing, which is where we put the baby on our hip and then we cock that hip. So yeah, just like fun little new ways to kind of move your body. And as you mentioned, they were like training to carry a toy, but there is a lot of like functional movement that happens after you have a baby, including bending down and picking them up multiple times, even if it's not all the way into a crib, right? You're still putting them in a stroller, you're still carrying the car seat. And, if you have a Duna, the car seat and the stroller together, and you're having to like heave and kind of lift that into your car, the back's weakest point is bent and twisted a little bit. And there's so much of that during motherhood, like just across the board. Um, so, and then with babies, right, as we mentioned, and a baby coming out vaginally, there's about 80 pounds of pressure put on their neck, head and neck as they're coming out. When baby settles into the pelvis, as you mentioned, their skull bones actually cross over each other a little bit, which is what that soft spot is that allows baby to be the smallest they will ever be. Relaxin also works on babies. So baby's bones are really more like cartilage at that point. And then baby's joints are really, really, really squishy as well. So again, and also to baby, a lot of people think baby is kind of passive, that you are the one doing all the work, but baby is actually trying to help you get down and out. Actually, a lot of times you can feel them kicking if you were to put your hands on your belly. So they're really trying to get themselves out as well. And again, that ring of fire, which is where kind of the vaginal tissue, right, kind of pulls on as baby crowns, is actually meant to actually get those skull bones back where they're supposed to. But again, that kind of goes into like, you know, is there a hand by the face as they're coming out? Are they posterior? Kind of all of those things. Are they slightly asynclitic? Even just coming out normally, like again, I say normally, you know, head down, crown first, crowning, nothing else going on. There's still a lot of pressure put on baby's neck. And so those patterns, again, that we had talked about when the brain exits the skull, it tapers into the brainstem, and brainstem is important in everybody, but it's incredibly important in babies because that is where all of the nerves that go to sucking, swallowing, cheek movement, you know, I mean, all of your cranial nerves, right? Eye movement, kind of all of that actually sits on the brainstem. The breathing centers of the body also sit there. It's where all the oxygen to the brain goes, all the cranial sacral fluid goes through that. And so as they're coming down and out, that's usually when the first misalignment of that area happens, going to put pressure on those nerves, right? So we were talking about latching issues. So babies who don't really kind of calm down, they stay really red. That can also be a sign, random, of um, kind of upper neck misalignment, not really wanting to turn to one side or the other, not being able to really open really, really wide to latch, or not being comfortable. And, you know, you're having to switch positions. A lot of times when you're breastfeeding, like one, you can do kind of cross cradle, or you have to do football hold on the other breast. Those are kind of all sort of red flags about why a chiropractor would want to see a baby so quickly. Again, my big thing is going back to that nervous system function. If we can take the pressure off the nervous system, then most of a lot of that other stuff doesn't even happen, right? Those other patterns. And then later on the road, down the road, ear infections, colic, all of those typically don't end up happening because we've gotten the pressure off of that nervous system and their body is working the way that they should pretty quickly. I'm trying to think if I answered your question. Oh, the actual adjustment for a baby, right, is actually not like what most people associate with chiropractic care, right? There's no cracking of a baby. It is literally like touching an avocado for ripeness. So I tell my patients a lot, or my parents a lot, especially if they've never been to a chiropractor, right? I do a lot of, we're going to talk, I'm going to explain everything I'm going to do before I even touch your child. But again, it's not going to look like I'm doing really much to them. It's very, very, very gentle holds, gentle pressure until I usually just feel the bone kind of shift back in. I do a lot of work around the sacrum, and then I actually do cranial adjusting as well. Just because there is a lot of pressure put on those cranial bones, and we want to make sure those sutures are working the way that they should be, and kind of checking palate, checking the way the jaw sits as well. Again, just to kind of mitigate their experience coming down and out as well.
No, that all makes sense. It's super fascinating because I feel like some of these things, of course, we've had conversations about and just, anticipating, kind of preparing. And then I'm still like listening to you and I'm like, oh my gosh, I had no idea about the timeline for like relaxing, like being in my system. And just again, kind of understanding some of these very scientific things, but like at a basic level, like it makes sense. Your body is, as the mom, moving in different positions depending on your labor experience as well as just postpartum. And then obviously for the baby, how the baby comes out, in general, just is going to have their body compressed. And so how do you kind of get them optimally adjusted, both physically adjusted, but just like, the idea of adjusted to this new world. I think as an aside, I heard something about babies are they colorblind when they first come out? Did I make that up?
A little bit. They really see in high contrast colors, right? Which is also why your nipples get darker at the end.
Right.
Right.
And then like all the black and white kind of, contrast colors. I heard that recently and I was like, oh, that's crazy. So literally the idea of them, they're getting adjusted to this new world, this new environment.
Very.
Um, yeah, like trying to figure out like I gotta, now find out where my food is coming from because previously I was, just like getting it fed to me through this umbilical cord. So it's just again to me just not a drop in the bucket. This is more like, filling up a pail of information, but it's just trying to touch on so much of this maybe unknown for someone who is their first time, or maybe it's a second or third birth and they didn't, go through getting prenatal chiropractic care or postnatal chiropractic care, or even chiropractic care for their baby, and their newborn. And so I really appreciate you taking the time again to, answer some of these questions and help inform me and inform my community, because again, really the intention is to open up these dialogues with people that I have really found a lot of resource and support and comfort from as I'm navigating all this stuff for the first time. And it's just grateful to be able to chat with you and introduce you to my people. So I would love for you to share with them how they can find you, where your practice is, what's the best way to book, connect, follow up, etc.
Awesome. So I actually practice in Northwest Austin off of Mesa Drive. It's like literally a block down or half a block down from Anderson High School. So in between Spicewood and Stack. My website is www.lotusatx.com. Obviously Instagram is at Lotus underscore ATX. There is a contact form on my website that will send us an email directly. My phone number is 512-270-9580. A lot of times if we don't answer, we're either helping other patients or whatever. You can also just text that number. Even if you're a new patient, you can just say, hey, this is so-and-so, and this is what I'm looking for. Sometimes that's easier for us to get back to. And it's also easier if you are a mom and you are interested in having your baby checked or even yourself checked postpartum, sometimes at 2 a.m, right? Shooting off a text message instead of actually having to remember in the morning when you have a new baby to actually try to call. It's actually really, really easy. We do a lot of texting, which is really nice, but yeah. And I was going to say, I think that's it. I'm not actually on Facebook, so I haven't been ever.
Facebook is one of those platforms I'm like, should I be on it again? I don't know.
Yeah.
But texting, you are great at texting. And I'll just add for those listeners, if you have questions, like drop them in the chat, drop them in the comments. I think both Allie and myself can and try to, answer and point you in the best direction as best we can. And also would love to hear from you guys on other topics that you are exploring and interested to hear about. And I will do my best to try to pull the experts in my network together to have those conversations for you.
Yes. And I will say, if you have listeners that do not live in Austin, right, or live in different parts of Austin, and it's not really convenient to come and see me, the International Chiropractic Pediatric Association, their website is www.icpa, the number 4 kids.org. And on there, you can scroll down and you can find a practitioner that is Webster certified, and within your zip code. Like usually you just type your zip code in. And I think you can narrow it down, but I think the default setting is like within 50 miles of where you live or 50 miles of that zip code. So again, if you don't listen and, if you don't live in Austin and you're hearing this, that is a really, really, really great way to find someone who is Webster certified, who does prenatal or postnatal or even baby care, pediatric care, or family care. That's even, I have to go back to that because I have, moms come and visit and they're like, oh, I wish I could find a chiropractor in my area. And I'm like, great, give me your zip code and we'll put that in for you. So just wanted to add that as well.
No, I appreciate it. Super helpful. Again, obviously, we love supporting our North Austin mom community. But we know that, people are living everywhere and tuning in, hopefully, from all, parts of Texas and beyond, and just getting, educated on this topic. And yeah, great resources to be able to plug in your zip code and find out where you can get some great care in your part of town. But thank you again, Dr. Allie. I appreciate you. And I think we have an appointment tomorrow. So I will see you tomorrow as I go into week 39.
Yes, but tonight is a full moon, so I don't know. It
And
always,
we'll end on a cliffhanger.
I know, right?
Everybody's like, no, really, is the baby coming? And I'm like,
Oh,
maybe, I don't know. Only he knows.
Well, if I see you tomorrow, great. If I don't, then that's also great because you've had this baby. But thank you so much for the opportunity. I appreciate it.